Hey everyone, Michelle here, personal trainer and lifestyle coach. Today we are here to talk about our August 2024 theme of the month, benefits of cold therapy. Now, last month we discussed the benefits of using heat therapy. This month we'll be discussing the benefits and methods of using cold therapy. Now, there are a lot of similarities to heat and cold therapy. Namely, that they are both external stressors that we are deliberately subjecting our body to. For this reason, you'll see a lot of overlap and some similarities in both the benefits and mechanisms of these two therapies. Cold therapy can be beneficial in reduction of inflammation, improved recovery, enhanced mental health, and increased metabolism. When it comes to short-term uses, cold can be beneficial in both reducing pain and inflammation, primarily in acute injuries. It is often recommended for the first 72 hours or so of an injury, like a sprain, to help reduce the swelling and mobilize the joint as quickly as possible. In addition to injury, cold therapy can also be used to increase physical performance and recovery from exercise. Cold therapy has been shown to reduce or even eliminate delayed onset muscle soreness, especially after endurance or performance-based activities. Now, it is important to note that if your goals are hypertrophy or strength, you may actually benefit from waiting at least 4 hours after your training session to do cold therapy. Now, as discussed with heat therapy and hyperthermia, occasionally applying a cooling source to a glabrous surface, like the palms, bottoms of feet, and upper face, could also increase endurance in a training session, both in cardiovascular and strength-based work. Now, deliberate cold exposure has many benefits to improve mental health, including enhanced mood and the ability to focus. As discussed with heat therapy, cold therapy is a eustress or positive stressor on the body, and this idea can be supported by the fact that it increases release of dopamine without any significant increases in cortisol, our stress hormone, which can be produced by most other stressors. Now, dopamine helps with motivation, increased energy, and mental acuity. Much of this effect can be attributed to the elevation in epinephrine and norepinephrine, or adrenaline and noradrenaline, that occurs from being able to get over what Dr. Huberman calls the wall of wanting to get out of a cold and uncomfortable environment. The resilience and grit that is required to continue to get over these walls also allows us to better cope with intense stressors that may happen in life. In addition to the benefits of recovery and improved mental health, deliberate cold exposure can also increase metabolism. White fat is essentially storage for lipids and it's ready to be used by the body at any time, while brown fat is used as a heat source for core temperature. Now, cold therapy can actually help increase both the mitochondrial output and density of white fat cells, converting them to either beige or brown cells. And since these cells are more active and are used to heat the core, you not only become more cold adapted, able to withstand lower temperatures for longer periods of time, but your basal metabolic rate, the calories you burn at rest, will actually increase as well. Now, in order to get the listed benefits, deliberate cold exposure should add up to about 11 minutes per week, and this can be split up between 2 to 4 sessions. This can be done as an ice bath, a cold shower, or even being exposed to a cold environment with minimal clothing. Similar to heat therapy, the temperature should be low enough that you're uncomfortable and want to get out, but not too cold to where it does not feel safe or you're at risk of either hypothermia or frostbite. It is important to let your body warm up on its own after cold therapy with a goal to elicit a shiver response to get the maximum benefits of that thermogenesis. Now, if you want to combine it with a heat therapy like sauna, you want to try and do the heat first and then finish with the cold. Now, in addition, the body's natural circadian rhythm starts to warm up your core temperature about 2 hours before you wake. So it may be helpful to do cold therapy in the morning to encourage the body to respond with its natural rise in temperature that occurs early in the day. Now, since the body will respond to cold therapy by warming itself up, there is also a possibility that doing cold therapy later in the day could cause the body to warm up when it should be cooling down for sleep, and that may actually disturb sleeping patterns. Now, as was discussed with heat therapy, to reap the most long-term benefits, this should also be a sustainable practice. So this month, try some different cold therapy methods and see if there's any that you feel like you could stick with long-term. I'll include some additional information below, and please let me know if you have any questions. Thanks so much. Talk to y'all soon.